My name is Javier Cuevas. I am the Senior Hispanic Outreach Lead at IQ Solutions in Rockville, Maryland, near Washington, D.C. My role with Combat COVID is to ensure that we promote culturally competent communications that help us educate Hispanics and other communities, leaders, and community members at large about COVID. The first pandemic in the United States in more than a century has tested us all. The COVID-19 landscape has changed daily since then. What has not changed is everybody's need for current and accurate information. That's what our discussion today is about. We'll speak with some leaders from Orange County and other regions of the Sunshine State about where we stand in this fight. What's working? How can we do better? And how can all of you help us win this fight? First, I would like to welcome the mayor. Mayor Demings, thank you so much for being with us today. Every county and every community in the United States has been hit hard by COVID-19. I'd like to talk with you first about what's happening in Orange County. What's the greatest challenge Orange County faces right now in combating COVID?
The rate of transmission is down significantly. Over 200,000 individuals have tested positive for the coronavirus here within Orange County, and over 2,200 of them have died of the virus. But with the advent now of the vaccine being available for children between the ages of 5 and 11, that puts us in a much better position. 76+% of our residents in Orange County have now been vaccinated, received at least one dose of the shot, and those numbers are going up each day. So I'm highly encouraged, but we all are at that point where we are fatigued now and we want to re-engage socially, but we want to be able to do that in the safest manner possible.
How have the people of Orange County helped to meet the challenge so far?
One of the things that we did here in Orange County, we created an economic recovery task force. These were about 50 volunteer members from our community who came together. They were business leaders, they were from academia, they were from the medical field, healthcare, and they all came together with input and expert advice on how to re-engage, and we developed an economic recovery plan of action that allowed our businesses to get back together.
With that, I would like to introduce somebody who's very close to my heart. I have known her for a few years now, and that is Dr. Novello. She is the former United States Surgeon General. Dr. Novello, thank you so much for being with us today. I would like to talk with you about what's happening at the national level. What's the greatest challenge we face right now as a country in terms of combating COVID?
First of all, living in the central part of Florida, I have to congratulate the mayor. He's done an outstanding job. The United States has vaccinated at least 59.2% of the people. We still are not at 100% when we produce the vaccine and we have given it for free. Some people really don't even know that the vaccine is free. And today you can find it anywhere, everywhere, at whatever time, and it will be given to you, and then our numbers will go higher, so we can finally have that wonderful herd immunity. So sometimes I believe that misinformation is worse than the virus, and for that reason, stick to the science, and stick to believe that for the first time, in spite of the fact that people are trying to divide us as minorities, let's not that happen for the simple reason that we are getting the information from trusted advisors, from our pastors, and from the African American Church that has been excellent in the distribution of information regarding this particular virus. So at this moment, vaccination must continue. Herd immunity is on the way. COVID is still not out. So we must always continue to have the mask. We always have to have the social distancing, and we always have to wash our hands and avoid places that are really crowded. Do not lower your guard. Do not lower your guard.
We have Dr. Edwin DeJesus. He's also a principal investigator at the active site that is conducting research on and clinical studies on how to actually provide treatment for those suffering from COVID. Dr. DeJesus, you heard Mayor Demings, you heard Dr. Novello. You have been at the front lines when it comes to COVID-19. From your perspective, what is it that public health officials, community leaders, and our viewers need to do if we are going to beat COVID-19?
Well, thank you for having me a part of this panel. To beat COVID-19, as As a public health official or community leader, I think that like Mayor Demings and many others in Central Florida have done, they should continue to spread the community, to their community, the factual information, like the one that is available on combatcovid.hsa.gov. And I think that the most important simple message would be that we need to, in order to beat COVID, we need to listen to the facts and to get on board. This is a public health problem that we all have, and it's not a problem that someone else has, but not me and you. So everybody needs to be part of the solution. We have measures that we have implemented, such as distancing and masking, that are essential that we continue to exercise while we get everybody protected with a vaccine. So in addition, we have today approved and in late stage of approval, several drugs to safely treat, not to prevent, but to treat COVID-19.
We're also going to have with us Pastor Keny Felix. Pastor Felix, during times like this, people seek guidance and counsel from both your professions. What experiences are you comfortable sharing with us about the impact of COVID-19 on your congregation and your community?
It's truly an honor that we're addressing this so important topic and that is impacting all of our lives at this moment. Definitely the pandemic had severe impact on our churches. The nature of churches is a collective body. We come together in close proximity. We had to close our campus for many months, in fact, just as a precautions. We relied on CDC recommendation and the health professionals that make up our church, so that we would be able to make the best decisions for our people. And we knew that we were making decisions not only for our congregants, but where our congregants would also go. So their families and their neighbors, because if they came in contact with the virus by coming to church, then that would definitely increase the community spread. And the second thing that we did is that after we moved all of our services online and all of our activities online, we also engaged in a campaign to properly inform our parishioners. Dr. Revelles is correct that there was so much misinformation, just as there continues to be so much misinformation. And our folks, I would say, were definitely exposed to a lot of misinformation when the pandemic started. And so we relied again on some of our health professionals to create forums to address concerns, to educate our folks about the pandemic. And then secondly, added to that, we also partnered with the county, Miami-Dade County, to offer testing opportunities on our campus by bringing in mobile units. We also partnered with the Florida Division of Emergency Management to actually offer the vaccine once it was approved back in January. And so we had a host of individuals being able to receive the vaccines through the services that were provided at our site. But one of the greatest impacts as well during the pandemic, not only that it led to people basically not being able to engage in what is so meaningful to not only to their faith, but to their existence. And so that was really challenging. And so we had to really come along and still do have to come along to help families cope with their grief. And we know that this is going to be an ongoing effort. One of the things that we are working right now is to develop grief share groups at our church, at our campus, to offer to the community and to our members to help them process their grief. And so once the pandemic settles in, I believe that people are probably going to be dealing with significant grief issues that they're going to need help with to maneuver through.
We have my dear friend, Maria Revelles, who is the state director for CHISPA, Florida. How have you used Salud y Familia, which is your TV show, to help people respond to the pandemic?
Salud y Familia is a weekly TV show, and it was born actually of the necessity of having these conversations, health conversations in Spanish, in a relaxed talk show environment with our communities. Those resources that you mentioned, Combate COVID, Combat COVID, the links from the state, the links from the health department, the links from the federal health department, there is the actual factual information out there. Vaccines works, the science works, your doctors are telling you the truth, and collectively what we want is for our communities to be healthy and come into the other side of this horrible pandemics. All Hispanics, we're one big family. I think we're ready to support each other, getting to the other side of the COVID pandemic and be healthy again.
This is a great opportunity to actually go back to Pastor Keny and asking us specifically about how can faith leaders help make sure that their congregations get access to timely and reliable information?
Great question, Javier. I would say definitely we need to work in collaboration with our health professionals. Our health professionals are the key to helping us understand the opportunities and the vaccines and the impact of the virus. And so getting direct information from our health professionals is a key, because again, there's so much misinformation out there. We have to understand that this has been a learning process. So sometimes the information will change. There's some things that we thought, or the scientific community thought initially, but as more research became more prevalent, and so that was updated. So we definitely have to keep stride with the latest. At our church, we continue to require masks to be worn by all members. Now, those who are participating on our worship teams do not. But what we had to do was reduce our worship team from 6 to basically 2 individuals who are socially distanced apart from the other. We've put our choir ministry on hold. We can all still yet worship our Lord, but we also have to be cautious and take the necessary precaution without taking unnecessary risk.
Dr. DeJesus, we invited the public prior to the event to provide questions. We have gotten a few questions about monoclonal antibody, or also known as MADs therapy. Can you explain what it is and who can receive the treatment?
Let's start with the concept that when a virus or a bacteria infects a person, our body immune system is going to respond by making a natural antibody to fight that particular bacteria or that particular virus. So the production of those antibodies by our system, by our body, takes several weeks to occur. During that time, the person can get really very sick. In the case of COVID, the so-called monoclonal antibodies against COVID are just immunoglobulins made up in the lab in a very controlled environment, similar to the immunoglobulins that our own body produces to help the immune system to quickly destroy the COVID-19 before the symptoms may get worse. So these are for people that have tested positive for COVID-19 and that they have mild to moderate symptoms of a disease, usually in the first week, 10 days after the infection. After that, these monoclonal antibodies seems not to help much. So this monoclonal antibody has been created as a tool to treat people with symptomatic COVID as an outpatient. And they can be very helpful in people with high risk of becoming seriously ill, such as people with comorbid conditions or people in which their immune system is unable to function to their full capacity.
I wanted to actually go straight to ask you a follow-up question, Dr. DeJesus, related to the concern that people have when it comes to medical procedures. Will people be treated with respect? You're a researcher, and Dr. Novello, you can jump in because you have been doing this your whole life as well. But will they be treated with the respect? Will they be able to actually, will they know that the researchers are going to care about them or their loved ones? Those are some of the questions when it comes to clinical trials. Am I going to be treated properly? This experimental? Can you provide more background? Because this is what you do for a living.
Before these treatments are actually put in testing in humans, they go through a very extensive and rigorous clinical research and to ensure that they are indeed safe. Now, regarding the safety in the participation of in a research clinical study, we must understand that the conduction of these clinical trials in the research community over the past decades, again, has evolved tremendously to develop paths that to find the way to prevent or to treat infections such as COVID. The advances in that technology that we have learned how to manipulate with the different parts of the virus have been widespread through the scientific community. And we have used all those advances in the development of proven and effective vaccines that we have today. In addition to that, there's multiple regulatory agencies that their job is to make sure that these measures are strictly followed, which has been put in place for over the years to protect people from mistreatment when participating in a clinical trial. And the FDA closely oversees the compliance of these regulations.
Well, my biggest worry now is COVID is bringing an epidemic of mental health in the United States.
Pastor Felix, this is your area of expertise in your other profession, which is somebody who helps with mental health issues.
Yeah, definitely. People are dealing with depression related to experiencing the pandemic. People are dealing with anxiety, the fear of the virus, fear of losing loved ones. So the need for individuals to receive mental health services is significantly high. I would say if there's a silver lining is that the stigma towards receiving mental health services has definitely decreased, but we still need to ensure that people are able to find services. And the other added dimension to this is if we're talking about minorities, we want minorities to be able to receive mental health services that are culturally sensitive to their needs, whether they are a teenager or whether they are adults.
We don't talk enough of mental health in Latino families. There's still a lot of a stigma around it, and it shouldn't be at this point. We ask each other, how are you doing? Last part of us agreed. I don't really want to hear what you're telling me. Well, let's do more of that. Let's sit there. Let's take this, let's shove the stigma out of the way. Let's have real, honest conversation in Spanish, in culturally appropriate settings, and we can make the difference.
Can you tell us in your own words about the success stories of the clinical trials?
The treatments are going to be as safe, as effective as the community that the treatment is being tested. So it is extremely important that we have representation of the entire community to then ensure that the medication that is being tested and perhaps eventually approved will serve equally well in safety and efficacy among all demographic groups. There are many clinical research centers throughout the country that are testing preventive and treatment measures against COVID. So the participation in a clinical trial is not just a one-layer benefit. It transcends to other people.
We all are in this together. We have to make a difference. We encourage you to visit combatcovid.hhs.gov and combatecovid.hhs.gov. This information is for you, about you, to make sure that you watching us at home are as informed as possible. Juntos podemos. Thank you so much, everybody.